Now, as we continue our coverage of the International AIDS Conference, joining us today is Violet Shivutse of Groots Kenya, a home-based care network of women's self-help groups and community organizations in Kenya. Their goal is to ensure that grassroots women are controlling their own destiny through their direct participation in the decision-making process. Ms. Shivutse, thank you so much for being on our show today.
Thank you so much.
You made your way here from the conference. Tell me a little bit about that. What has been your input at this conference?
Kenya, as a country that was really hit with HIV/AIDS, the grassroots women have really taken a lead in fighting HIV/AIDS through organized groups of caregivers. My background is I'm a caregiver, and in 1999, by the time HIV/AIDS was being declared a disaster, we had already taken the assumption of taking care of people living with HIV/AIDS because of the collapse of health systems in Kenya. And what we have actually been doing is ensuring that these people are going for medication, ensuring that there are other aspects apart from treatment that are important in the community, the social welfare of the people living with HIV/AIDS, care for orphans and vulnerable children, and also advocating for creating alliances of caregivers to be realized as important players in HIV/AIDS, to participate in decision-making and planning of HIV/AIDS activities, and even monitoring resources that come to fight HIV/AIDS in Kenya and in our communities.
How much headway have you made as a group since its founding in 1995 in terms of really filling that void?
Our core program is enhancing participation of women and development in their community to meet their destiny, where they want to reach. And what I've seen is initially people didn't realize that as much as our mothers worked on the farm, as much as we worked in the community to promote hygiene and many things we have done, we are not players in development. We are always looked upon as beneficiaries of development. What I could say we have really achieved is making a change for people to realize we are change agents, we are reliable, we are sustainable, because we are not like NGOs. There's no time I'm gonna face out of my community. I remain in this community. Any disaster that comes, whether HIV/AIDS, climate change, issues of anything that comes in the community, the increased number of orphans, I remain in the community. So I think the headway we have gone is formation of a home-based care alliance, which brings together 12,000 grassroots women in Kenya that work as home-based caregivers. This includes caregivers themselves affected with HIV/AIDS and women living with HIV/AIDS in Kenya.
So you've made several presentations at the conference. What kind of appeal or focus are you trying to command at this point?
In this conference, we are speaking on a very parallel line for sure, because most of the presentation I'm seeing from the policymakers, the people who are in lead of the global health initiatives like WHO, PEPFAR, I see them really concentrate on treatment, strengthening health systems. They don't seem to be believing that organizing is a tool, or no one is speaking about organizing. And believe me, without organizing, we wouldn't be where we have reached with HIV/AIDS fight. We wouldn't have achieved the results we are achieving, because communities are able to respond effectively when they are organized. Grassroots women believe in organizing, but development partners have never embraced organizing as a tool to fight HIV/AIDS.
Tell me very
appeal I'm
briefly,
making.
what do you want people to know about the significance of home care and caregiving?
I want people to know that care is about humanity as much as it will not be costed like a treatment, but it's about people's welfare, and it needs to be realized as an important tool in fighting HIV/AIDS. Initiatives that advance care need to be strengthened, and caregivers need to be recognized as important players and be part of decision-making, planning around HIV/AIDS, and programming and ensuring resources reach them. We need to be resourced as caregivers.
Thank you so much, Ms. Shivutse, for taking the time to come out. That's Violet Shivutse of Groots Kenya and Home-Based Care Alliance joining us here on In Focus.